Dr. Williams, how does the treatment of children differ from the treatment of adults in general concerning the practice of medicine?
Oh, a lot of ways. Children are different in almost every way. They're different in terms of their approach to life. They're different in terms of their view of the world. They're different in terms of how they see things, and their diseases are different. For example, in adults, the most pressing issue with healthcare probably deals with heart-related diseases or cancer or things like that, whereas with children, they're very young. They're not going to really have a lot of these types of illnesses. Many kids are really going to have diseases that you want to prevent. So prevention is critical, whereas for an adult, you might be worried about their blood pressure or their blood sugar or something like that. With a kid, you really want to make sure that they're getting their vaccines on time. You want to make sure they're growing well, they're developing well, that they're acquiring skills that they need to have, that they're learning how to speak on time, for example. The nature of their illnesses is different. The kind of bacteria that they acquire for infections are different than adults. And so the treatment is by necessity different. It has to be different. And the focus on children really is to provide them with the ability to develop and grow in a way that allows them to be healthy adults. The focus on kids really is to a large degree on prevention. Those few times when children do become ill, when they do become acutely ill, then we focus on that specific illness. But that's not common, thankfully. That's not often. The most pressing issue for kids really deals with the things I just mentioned, with their diet, with whether or not they're exercising, whether or not they're learning on time, whether or not they're growing and developing on time according to and acquiring the skills they're supposed to at the appropriate ages. For acute illness, ear infections are big, but in general, kids really are fairly healthy. And sometimes, despite their conditions, given the minimum of care, children will develop and grow very well. So our focus really has to be on preventive services for kids. That's the biggest difference.
I think that many parents will tell you that from birth until the age of 18, the course of a child's life as it relates to a doctor's office is that the child will, of course, be in the doctor's office very frequently from birth and infancy, and then maybe the years, toddler years, and then children don't usually show up very often or much less often in a doctor's office after, let's say, school begins, at preschool or school age. Is it, and the children, they seem to be growing well and they're not sick. Is it, even though they're doing well during the ages of 7 to 10 to 12, even the teenage years, is it still important to come for an annual evaluation to the doctor? And if they're doing well and nothing is bothering them, why is this important?
Absolutely, it's important. And the reason why is because, like any developing organism, it's important to really track and make sure that that organism is growing and developing well. Now, children are more than organisms. Children are literally the lifeblood of the next generation. They are going to be the productive citizens of the country. And very often, for many families, especially smaller families, children represent the next generation for that family. And in order to really make sure that these children are developing and growing and doing the things that they're supposed to be doing at critical moments in their life, for example, between the ages of 5 and 10, children are acquiring new skills almost every 3 to 6 months. They're learning how to read, they're learning how to write, They're learning how to interpret the world around them. And as they become older and reach their pre-adolescent period, 9, 10, 11, they're learning how to think abstractly in a way that is different than previously, and in a way that will follow them through the rest of their adult life and how they interact with the world. And that's important. It's important to make sure that these kids are really tracking along a good curve, that they are developing in a normal way, that they are acquiring the skills that they're supposed to acquire at the appropriate times. And it's very hard to do that if a child is only coming to the doctor every 3 or 4 years, or only when they're sick between 5 and 10 years of age. Sometimes we see children who have been missing from our practice for several years, and when the parents bring them in for an acute problem or for an emergency, we also find that there are other things that are going wrong. For example, I've had situations where children have been brought in at the age of 7, 8, or 9 for an ear infection, and we found out that they're not growing well, and that they've had problems either with their thyroid, or they've had problems learning in school. They may have been kept back in school because of an undiagnosed learning disability, or that they have some emotional problem, which is impairing their ability to process information or to acquire the skills they need to acquire in order to learn in an appropriate way, or interact with their classmates, or even with members of their own family in an appropriate way. And by that time, it's harder to really play catch-up and get these kids into appropriate programs, or channel them in a way that allows them to really begin to compensate for these issues. So if I was able to see these kids, if I'd been able to see these kids sooner, it's more likely that they'd have a greater degree of success in compensating for these deficiencies. The biggest thing that we're learning about kids right now, and the most amazing thing, is the plasticity of a child. Not just their ability to overcome significant illnesses or to overcome significant developmental disorders, but the ability for children to acquire new information and to rewire their brains in order to achieve and compensate for the deficiencies that they may have. It's an amazing ability, but there's a critical period at which you can intervene to maximum effect. And if you pass that critical period, it's much more difficult to then catch up and get those kids channeled into a regular school program. So it does make sense for these children to follow up on an annual basis, if for no other reason than to make sure that they're developing normally.